I'm David Victor, president of American Educational Institute, and we're on set right now. Before we're about to tape a lecture with the famous, at least to the AEI audience, Dr. Kuritzky, a perennial favorite with the viewing audience. And if you're viewing this, the chances are about 50% you already know who Dr. Kuritzky is. What you didn't know, though, is that he and I are identical twins. Okay, that's the humor part of the section. Getting serious now. So Lou is going to speak today on the things I wish I knew last year, to Winkley, perennial favorite with our audience. Literally, this is the only lecture, Lou, where if we don't present it in a given year, I get emails and letters and calls saying, where is it? Make sure it's on next year. So I haven't made that mistake again in a long time. So this lecture is so popular because Lou identifies some treatments or medical facts that, while very useful, are relatively little known within the practitioner community. So I'm going to turn it over to Lou to just preview, kind of tease you with 3 or 4 of those items. Lou.
Well, Dave, I think that's a really good description of what we're going to engage in. 5 things I wish I knew last year is not generated from the lead article in New England Journal or JAMA, because everybody's seen that and everybody's heard about it. It appears in the newspaper, on television. Rather, there are things that are important for everyday activities of many clinicians that would serve their patients and them well that have been overlooked. So I try to collect those and share them with audiences around the country. I'll give you a couple examples.
Yeah, good.
Not all the news is necessarily positive news. Sometimes it's things that we're doing that we maybe shouldn't be doing. And it takes us a while to recognize when we're on the wrong path. So we'll talk about use of aspirin in diabetes, with the consideration, should we be a little more hesitant to give it? We'll talk about a new safety boundary for metformin. Metformin is the mainstay of diabetes therapy.
Right.
And yet previously it's been recommended that we withhold it when we reach a certain threshold, and that's depriving some people of what could be their best foundation medicine. Even the FDA has loosened up and said, we got more room to use this medicine effectively. And then a common thing like NSAIDs. I don't know anybody who hasn't taken an NSAID at some time in their life. There are tens of billions of doses over the counter sold in the United States every year. And yet, even though they are generally safe medicines, there's important considerations to watch out for as far as elevations of blood pressure go. So I want our colleagues to be as informed about these potentially really important issues that have been somewhat overlooked as they possibly can, and I'm glad you give me the opportunity to share it with them.
Well, and we're glad that you take the opportunity, and you do every year, and our audience, more to the point, is truly glad. So as they say, but wait, there's more, and there is much more. Those are just 3 of the items. There will be much more. If you want to hear it all, hear those 3 in depth and hear the others, and I guarantee you it's worth your while, you'll have to watch the talk.